To today's webinar. This webinar is part 2 of what parents need to know about food allergies in schools. I'm Linda Mitchell, and I'm president and founder of Kids with Food Allergies Foundation, and I have the privilege of being your moderator again today. Today is the third in a series of monthly webinars we will be offering on a variety of topics of interest to parents raising children with food allergies and their caregivers. The format of today's webinar will be a bit different since it's a follow-up of last month's webinar. We have a panel of 2 pediatric allergists and 4 nurse leaders who will be answering questions that we received during last month's webinar, as well as ones you submit today. This will be a very interesting and lively session, so I'm sure glad you've joined us. As always, I want to extend a special welcome to our family members and a special shout out to our donors and family members who support the Kids with Food Allergies Foundation with their family membership subscriptions and donations. Your financial support allows us to create new programming like these webinars. I know many of us have children heading back to school this week or next week, and as a parent who once sent her own child off with food allergies to kindergarten, it can be a time when you worry about whether you have everything covered. Since there's so much to consider, it's helpful to understand exactly what to prioritize and to work on to make sure your child is safe while in school. This webinar is designed to give you some help with prioritizing your school planning. We have a panel of wonderful speakers today led by Dr. Michael Pistiner. I've known Dr. Mike for several years now, dating back to when I met him at an allergy conference and he asked how he could help us. As a passionate patient educator and an accomplished pediatric allergist and a dad to a son with food allergy, he's since taken on the role of the chair of KFA's medical advisory team, and he's doing an amazing job. I also want to welcome Nancy Palmier-Swendris, RN-CSN, a certified school nurse and also a member of KFA's medical advisory team. Nancy is the program coordinator for the University of Michigan's food allergy program, and she's also a certified school nurse in the Ann Arbor, Michigan School District. Ann Arbor, Michigan was one of the first districts in the United States to develop food allergy management policy, so Nancy understands the important role of schools and school nurses in keeping children with food allergies safe. We also are fortunate to have Dr. John Lee on the panel today. Dr. Lee is a pediatric allergist at Boston Children's Hospital, and he's co-founder of allergyhome.org with Dr. Pistiner. Since completing his fellowship at Children's Hospital, he remained on as clinical instructor in pediatrics at Harvard Medical School, where he sees patients and is involved in training allergists. He also is the co-director of the eosinophilic gastrointestinal disease program, a center that focuses on treatment of eosinophilic esophagitis and other allergy-related conditions involving the GI tract. We also have the following wonderful nurse leaders joining us today. Ruth Hoshino, RN, is the school nurse leader for the city of Newton, Massachusetts. Ruth is responsible for the school health services program that supports the district's academic mission for its 11,500 students. Michael Corgiolo, APRN, CPNP, AEC, is the Health Services Coordinator for ACEs in Connecticut. Michael is an advanced practice registered nurse, a certified pediatric nurse practitioner, and a certified asthma educator. He is the current president-elect of the Association of School Nurses of Connecticut. Nancy Doobie, RN, MPH, is the main school health nurse consultant. Nancy is the school nurse consultant who works with school nurses, administrators, staff, families, community members, and other agencies throughout the state of Maine and in other areas in New England states. What a terrific panel we have here today. I feel so fortunate, and thanks to all of you for joining us. Before we get started, I'd like to run through a few important housekeeping details with you about this webinar. And during this time, I'm going to put up 3 polls for you to participate in. First of all, today's webinar is being recorded, so if you miss anything, don't worry about it. You'll be able to see an archive of it and listen to it shortly. You'll receive a follow-up email from us within 48 hours or so. It will include a link for you to view this webinar again or share it with others. Next, today's webinar again has a very large audience, so we've put everyone in listen-only mode. But since we want this to be interactive, we want you to participate through polls, and there's a chat box that you can ask questions, or a questions box, I should say, or comments, and we'll be able to address them as we have the time. Our panel will be starting with a discussion of topics from questions submitted from last month. And they've also agreed to have a Q&A session at the end for any new questions that may have come in that we haven't already addressed. Also, during the session today, we're going to be giving away 3 copies of Dr. Mike's children's book, Everyday Cool with Food Allergies. The recipients of those gifts will be picked randomly from those still in attendance towards the end of the webinar. When we end the webinar, you'll see a survey, and we want you to tell us how we did and what we could do better, and what ideas you have for future webinars. So without further ado, I'd like to introduce the panel discussion leader, Dr. Mike Pissner. Michael Pissner, MD, MMSC, is a pediatric allergist and a medical director of the medical appointments or shared medical appointments for Harvard Vanguard Medical Associates in Massachusetts. He's also an instructor of pediatrics at Boston Children's Hospital and is the father of a child with food allergies. He serves as a voluntary consultant for the Massachusetts Department of Health, School Health Services. He's a fellow of the American Academy of Pediatrics, where he's a member of the Council of School Health and the Section of Allergy and Immunology, and is a member of the American Academy of Allergy, Asthma, and Immunology, where he's a member of the Adverse Reactions to Food Committee. He's chair of our medical advisory team for kids with food allergies. He's on the board of directors for the Asthma and Allergy Foundation of America New England chapter, and is also a member of the National Food Allergy Management and Education Advisory Board. In his spare time, I don't know where he finds it, he's the author of Everyday Cool with Food Allergies, and he's the co-creator of allergyhome.org, a website that provides free modules designed to educate the community on food allergy awareness. So I'm going to go ahead and start with thanking Dr. Mike for putting together such a wonderful panel of experts here for us today. And what I'd like to do now is hand the virtual mic over to you so we can go get started with the poll results, and then you can get started with the panel discussion.
All right, well, welcome, and I really want to welcome my friends and colleagues for joining me and answering and fielding some of these questions, and I hope that our discussions are helpful for everybody who is joining us. Thanks for joining us. All right, so our first question, what is the age range of the children with food allergies that you care for? It looks like the majority are kindergarten through elementary school, and we have some infants through pre-K, about 40%, and then we have some parents and caregivers for middle schoolers, and then also some high schoolers. Now our next poll question, does your state have food allergy guidelines for schools? About a quarter say yes, about 20% no, and many don't know. And we will address which states do have this. We will if we could get a map up now, we can do it now, but if we can't figure that out, then we'll address this in a bit. And I think what we'll do is we'll move on, but we'll discuss which states have guidelines, and that'll be significant in what we're talking about. Now, as far as whether or not your school has a full-time school nurse, about 45% report yes, and about 55% report no. All right, and with this, I'll punt it back to Linda.
Okay, I'm going to get started with the first question. Okay, so the first question, and we're going to have it up on the screen in a minute, is what are some examples of effective ways to reach out to school staff, like the principals, school nurse, teachers, who do not seem to have a good foundation of food allergy knowledge and or are resistant to setting up a food allergy plan?
And then just as a brief introduction to where we're going to go as a panel on this, what's most important is a good, solid partnership with your school community, and if you have a school nurse, your school nurse. And when I mention school community, not only would it be the staff, the administration, and the nurse, but also the parents of the children with and without food allergies, and also the students with and without. Anybody else want to take some specifics?
This is Nancy Doobie from Maine. And I think it's really important for everyone to understand that you need to build an alliance and help everybody understand and get past. Everyone comes to this with fears, and you have to speak about the fears and find the trusted liaison and find that advocate that's going to help you and your child be safe as they can be in the school setting. And rather than a push-me-pull-you setting, it's sitting down at the table and say we're all here with one goal, and that's to make sure that this environment is as safe as it can be for my child.
And this is Ruth Hoshino from Massachusetts speaking, and I think that the trusted liaisons, plural, is everybody that you can enlist in the process, including the classroom teacher, specialists in the school, the physical education, library, music, staff, and as well as classmates. And sometimes, especially with younger children, when the parent comes in, perhaps reads a book or talks a little bit about food allergies, sometimes those classmates of that student become great allies. And then, of course, the school nurse, if you're fortunate enough to have one in your building, particularly on a full-time basis, that's going to be a real partnership that's going to be mutually benefit to both of you once you form that relationship.
The nice thing also is that in the past, the responsibility of education has fallen on the shoulders of the parent. But now, with increased awareness and more children with food allergies, now this is becoming something that is more broadly being seen in schools, and no longer only the responsibility of the parents, but now also the responsibility of teachers, nurses, and other school staff. And what's nice is this way, with these liaisons, it isn't necessarily the parent needing to change the behaviors of others, but the parent being able to have a discussion with this nurse, who then is able to say, it's not because of one specific child, but because of children with food allergies. This is why we need to do it, not because of the needs and the requests of one family, but because what is standard of care, because what is safe, because what is necessary.
This is Nancy Pete. When I also work with families, I really encourage the families to actually set up an appointment with the important liaisons in the school versus trying to do it during transitions and very, very busy times when people can't listen. So to set up a time to meet with whoever's important in that particular school, and also, as the screen shows you, to actually bring sound guidelines or guided documents that you can actually share with staff that might not have that information.
Oh, hi, this is Mike Corgiulo. I'd like to just add to that a little bit also and say that I think there's a lot of misperceptions that when you clear some of that up, it adds a lot of credibility to what you're trying to do across the board. Again, getting away from trying to make an allergy plan for every individual student. I mean, they need to have their own individual plans, but as far as having some guidelines for an entire school or entire district, so you're not singling out a single student and you're trying to apply some universal guidelines through the whole school, that helps a lot.
And we're really lucky nowadays that these state guidelines are popping up. And what this map shows us is where in the United States currently we have guidelines that are being used. And this really can be very helpful, especially if families are experiencing some pushback, because then they can, as Michael was mentioning, they can refer to these that are standard, not just for a specific child. And this way it does take a little bit of that onus off of the individual and does say, look, this is best practice. So most of the country right now doesn't have these guidelines. Federal guidelines are going to be coming out. Ultimately, when they do, each of the states that already has the state guidelines are going to be the ones that will ultimately be implemented. But it definitely changes the face of dealing with food allergies in schools once you have these established.
And this is John Lee. And so we've also talked about building this community of support so that have the children in the classrooms really get involved, understand what food allergies are, have the teachers involved, have the parents of other families and classmates so they all understand really how, what food allergies means, what it means to really try to take care of our children safely. And so it's important to involve them as well as the doctors, the ones who actually would come up with the diagnosis, and they can actually help with really outlining what risks are for each individual child and come up with a diagnosis that can, and they can also help work with the schools in trying to build these guidelines for the children.
If I could just interject for a minute, someone just asked, can you give some suggestions of PTO or PTA-related activities or groups that can be created to help form a community within the school for those dealing with food allergies?
One of the things that I've been talking with nurses and other school folks about, and other allergists, and John and I have been really working on, is trying to get PTOs and PTAs, upon welcoming new families to the school, introducing what it is that kids with food allergies need to do, and this way to get more buy-in from the community and allow them to understand, these are necessary and important steps. Now I have an understanding because I just was given some information and I was just educated by my PTO, PTA, and I get it. Not only that, when it deals with management of food allergy in school, but these are the same families that us as parents are going to be dealing with throughout the years, the drop-off parties, the drop-off play dates. And if these families, upon entry into school, actually are educated, then they will be our allies. They will be so helpful when we do pass off responsibility and we are going to need someone else to make sure that prevention and emergency preparedness are being implemented. Once that basic education is given, it can give the other families the impetus and the baseline knowledge to build upon that, and they could really be our very important helpers and allies.
This is Nancy P. Also, as a school nurse, we work very closely with the PTO in educating the members in that organization about all kids with special needs. So we don't always just focus on children with food allergies, but we'll do education information about kids with seizures, diabetes, asthma, so that all the focus is not just on the child with food allergies. And we believe very much so that knowledge is power for these families.
And this is Ruth from Massachusetts again. And having been a former PTO president many times, I can tell you that at meetings, you're always looking for some good agenda items. So I think if parents of children that do have food allergies want to bring it to the larger community of parents, if they go to the PTO presidents ahead of time and say, I have an idea for an agenda item, and be willing to contribute in terms of helping educate, or maybe bring in some community pediatricians or other parents in the school who are professionals that could speak to the issue. The presidents of the PTO would welcome that, and then hopefully it would be an interesting topic along with some other matters at a meeting.
Terrific. Well, thank you. How about if we move on to the next question, unless anybody has some closing thoughts? What health information should be shared with the school in order to set up a food allergy action plan, an individual health plan, or a Section 504 plan for my child, and which doctor should provide it? A pediatrician, an allergist, or someone else?
I'd like to take a stab at that. This is Mike Cordulo. One of the things, the issues that I know a lot of the nurses I work with find very challenging is when kids enter a school with history on a health form that lists a whole slew of food allergies that may or may not be accurately or currently medically assessed. So having an updated evaluation and an accurate list of exactly what the student is allergic to seems like such a common sense place to start, but it often is one of those areas that school nurses really struggle with.
And folks who can help families with that are families' healthcare providers. Now, some children aren't going to have ready access to allergists or specifically pediatric allergists. Some children will rely on pediatricians, family practice doctors, depending on where you live throughout the country and who's available. And some wait lists can be very long. So really, any provider who is caring for your child can fill out the necessary healthcare information for these. In the case when children are not, where schools are unable to help the child progress because of their allergies and they are requiring 504s, if an allergist or pediatric allergist is available to help with that, that would be optimal. But pediatricians and other healthcare providers really can be very helpful in filling out any of these health forms and information.
And this is Ruth.
Just
and
like,
it's always important to have a sit-down meeting with the parent, just as previously was suggested, that it not occur at pickup time or drop-off, but a scheduled, uninterrupted time where the parent can really describe their own child, since they're the expert on their child, and what their own health history has been related to food allergies, how they've introduced that to their own child that's developmentally appropriate, but a real direct one-on-one with the school nurse, with the classroom teacher, with the principal if that's needed, or the whole team if that feels like the right match.
This is John. I just wanted also to add that just like in any profession, there's going to be physicians or nurse practitioners who have varying levels of food allergy experience, so that if you do have concerns about you trusting what their guidance for you, it may be worthwhile to look for another doctor to help you, because there have been some doctors who may not be up to date with the best practices, and so they may not know what may be in the best interest of your child.
This is Nancy P. Also, if your school district does not require that your child have an up-to-date food allergy action plan done annually for your child, I would personally work with my healthcare provider and I would use the one that you see on the screen from the foodallergy.org, which is a great food allergy action plan. In our district, we actually educate all the staff using this particular plan so that they know ahead of time how the plan actually works versus trying to read it during an emergency. So we really try to, because there are many, many food allergy plans that are in the districts, and it's hard for staff to figure out what they all mean, and especially what they mean in an emergency. So as school nurses during professional development, which we're doing currently, we teach off of this plan so that they at least have a consistent message of how to treat your child in an emergency and what that actually plan means.
And just to add to that, it'll be really important for you to have an understanding of it, to take a look at it when your healthcare provider gives you one of these action plans. Make sure it's legible, make sure that it makes sense, make sure that anaphylaxis, which is a severe life-threatening allergic reaction, is indeed being treated with epinephrine. That's what's nice about this particular plan that you can see up on the screen from the Food Allergy Anaphylaxis Network, which is they do have the appropriate symptoms requiring epinephrine. And that's something that you're going to want to make sure is happening with your healthcare provider. And also remind your healthcare provider and remember yourselves that these action plans, they are for you in the community. They're also for your school nurses, but they're also, if you have them, but they're also there for delegates, for non-licensed people who are caring for your child when a school nurse is not present. And so they're going to need to be able to read it and understand it, and it should be simple and easy to follow.
Right, and just a quick reminder that this food allergy action plan by FAN actually is a very good one. They just updated it, so just make sure that you do have the most up-to-date plans. From time to time, I do still see the older versions circulating around.
Okay, thank you. There's been a few questions that have come in during this discussion regarding 504 plans, and they're a very complex topic that we want to devote an entire session to. So we're just going to do some just very brief addressing of 504s during this particular webinar, and we'll be scheduling something regarding 504s in the future. So I just wanted to reassure you about that. Okay, we'll go ahead and move on to the next question then. Are food allergen-free classrooms recommended, and for what ages and circumstances?
All right, so this is a hot button issue in the world of food allergy, whether or not schools should be peanut, tree nut free, whether calling it that is a misnomer, and then also whether or not a classroom should be. Now this is a difficult issue to just give a blanket statement to. The issue is that you're really going to want to make sure that any school policy, any guideline is really going to make sure that prevention and emergency preparedness are in place at all times. Now, what happens sometimes is when a school is called peanut-free, tree nut-free, it can decrease the vigilance. It can decrease the prevention strategies that should be implemented. It can give a false sense of security. It can also send a message to the children who we want to be implementing prevention strategies in an age-appropriate way at all times. And so I just wanted to kick that off. Is there anybody else who wants to jump in?
This is Nancy Doobie from Maine, and I want to echo that, Mike. I think, Dr. Mike, that is true, and it does. When you say you're peanut or nut-free or whatever the food allergen is free, people become complacent. What we've done in Maine is we've become peanut aware, and we've built signs that say this is a peanut aware environment. Know that we have children who have peanut and tree nut allergies, and that we ask you not bring any of that into this school. That doesn't preclude the UPS man from just having had a peanut nutter bar and dropping off boxes of scholastic books. It's going to happen because schools are public environments. But the signage does help, and we change it 3 times a year. So because people become complacent with signage, they see it and then they don't see it anymore. So we do change it out. So we help schools that way.
And then as far as
So Nancy.
Yes, Michael?
Go ahead, Michael.
Oh, yeah, sorry about that. So in Maine, are you saying that you asked all the students to not bring in peanut or nut products to school?
It varies. Maine is one of those states with local decision, and it becomes the purview of the local school administrative unit for how they use the information we share with them. So it varies, Michael, but what we give to them is all of the information to educate themselves, and we encourage the school nurses to educate their staffs to understand what we're talking about. And then we work with the families to see just what level we work in the classroom. We do have classrooms that the parents work really hard with the school community to set up an environment as safe as possible, knowing that the school itself may have other variables in it.
Thanks for the clarification.
Mm-hmm.
And similarly, this is Ruth from Massachusetts. Similarly, in our district, we have a variety of approaches depending on the school and the specific community of people in a given classroom for that school year. So there are some parents who do ask that we send out a letter from the principal and nurse requesting that people refrain from sending in particular food allergens, but recognizing that we don't have 100% control over that, and not calling it a peanut or tree nut free classroom, but aware, just as I believe Nancy said. And we view that as a strategy to help with avoidance, particularly when children are very young. But as the children grow and develop, and a sense of trust is established with the school, we see those same parents who had that high level of discomfort saying, I think it's okay to have people start introducing those foods into the classroom because we know that there are other avoidance strategies in place. There are good hand washing practices and good table cleaning, and that people are aware and there's a focus on that. And so as my child grows and develops and it's more appropriate, I want to start introducing that. And then there are always some parents who right from the get-go say, I'm fine with whatever needs to be in the classroom being there. I've counseled my own child. I believe that you're going to take those precautions, and I'm good. So we try to meet people where they are.
And things to keep in mind that are going to really change based on the child and change based on the age within the schools and within the classrooms is their developmental level. That in the kindergartners, they're going to be exploring their environment a bit more with their hands, putting their hands in their mouths, picking their nose, rubbing their eyes, more than the high schooler who's going to be excellent at washing hands, good at reading labels. And so you're going to have very different strategies and approaches with the different populations based on what they can pull off as far as risk of cross-contact and exposure to hidden ingredients.
Great. I have one related question, and we've had a few folks ask and whatnot about hand washing and whether wipes are sufficient, or if the teacher or the school doesn't really advocate having all the children wash their hands, say after lunchtime. What can someone do about that, and what are the best practices?
Well, I'll just speak from a small study was done looking at different hand cleaning strategies, and this was on adult hands, and what they found was that wipes did work. That keep in mind Purell did not, and keep in mind also that these are adults using their own wipes to wash their hands as opposed to kindergartners or first graders washing their hands with wipes because everybody's watched them do it, and I don't know how effective my son is at cleaning his hands. But I would pass off to our nurses what experiences have the schools that you've worked with had as far as how do they pull off the hand washing after meals in a practical way.
So this is Nancy, one of the school nurses, and even within our district, there's about 20,000 students in our district. Each school has actually even dealt with this, these guidelines in a very different way, depending on the needs of the specific children. So we actually have, in some schools, hand washing stations that are actually in the cafeteria. In the preschooler, in the lower K, the district actually supplies to all classrooms with kids with food allergies the hand wipes. We really encourage classrooms, if they have the time and the energy, because we know it takes a lot of energy to have the children wash their hands, just to get into that habit. And we've even shown evidence that with all the hand washing that's gone on for the food allergic children, it has actually reduced a lot of the different communicable diseases, especially in the kindergarten and lower elementary classrooms. So we still, as school nurses, really promote as practical as it can possibly be about hand washing, and then use other strategies depending on developmentally appropriate for the older kids.
And this is Ruth from Newton, Massachusetts, and I think that we just acknowledge up front at the beginning of the year when we speak to teachers and we're doing our annual training that hand washing does take time, and it does delay getting back to the work of the academic stuff for the education, but we talk about those collateral benefits as well, about good hand hygiene and infection control, fewer kids out with illness, less likely that the teacher will become sick. So we try to capitalize on that, but acknowledge it is going to take a little bit of time, but if everybody just does it and does it efficiently, then it gets to be a really good practice. But in a pinch and when there isn't enough time or sink space, then we do encourage the use of hand wipes as well.
Okay, thank you. I guess we'll move on to the next question. Which school staff should be food allergy trained, trained on symptoms, how to respond, etc., and how do you ensure that those adults are trained?
Hi, this is Mike from Connecticut, and the fundamental principle that we follow has to do with some of our legislation. So over the last few years, we've had legislation here in Connecticut, like a lot of states have, that have expanded the different school roles and the ability for the school nurse to legally delegate training for epinephrine administration and allergy symptom recognition to a non-certified staff and paraprofessionals.
And my simple answer, this is Nancy Doobie from Maine, and simple answer for me as a consultant to all school nurses is you train everybody as much as you can. Knowing that people will have the right to refuse because we don't have any law that says that they must be trained. So staff can say, I don't want to be trained, but I encourage the school nurses to train as many people as they can, both in the awareness of allergies and then how to use an EpiPen.
Yes, I'd like to just clarify and build on that. Oh, sorry, John. Just to clarify, with the training we do on an individual level based on, especially, for example, if a staff member is going to be responsible for a student on a field trip. But we also do, at the beginning of every school year, an overview of our food allergy plan for all of the staff, and it includes recognition of allergy symptoms and a review of how to use the epinephrine for everybody.
And oh, I'm sorry, John, take it away.
Yeah, I just wanted to add that, I mean, that the controversy occurs when there are some schools that don't have a school nurse or a full-time school nurse, because, I mean, really to use an EpiPen, you really do need a one-on-one training with a hands-on person there to show you. I mean, there may be some other tools available which can be used as supplemental, but that's really why the role of the school nurse is key in this regard.
And some schools, unfortunately, we don't have full-time school nurses available, and that's where the staff training is absolutely essential. And so Michael was mentioning that all school staff should be trained in some fashion. It's so incredibly important, especially in the schools where they don't have full-time school nurses, that everybody be able to recognize allergic reactions and anaphylaxis, because that's where timing is absolutely essential. Every minute is going to count, and so if there is a staff member who is familiar with what anaphylaxis is, their school's emergency protocol, whether or not a school nurse is available, they will be able to know what to do, to implement it, to call 911 and get the people who can take care of that child. And so that's where PAN education is really important. And then there are going to be some schools where everyone's going to be trained, and other schools where a select few are going to be trained as delegates, as people who would be able to administer self-injectable epinephrine. And this is going to vary school by school and state by state. And so checking in with your school nurse or administration to find out what your school's policies are, and as far as who they and to what degree the staff is trained, will be something worth doing.
This is Nancy. Also, some school districts have gone to all online training for their professional development in regards to bloodborne pathogens and food allergies. So allergyhome.org has a wonderful online training if that's what that school district has gone to. So I think it's important for families to know that there is some good sound information online that staff can do in regards to food allergy, along with if they do have training in school. We even recommend, if possible, that there's biannual training, because a lot of staff really forget after the holiday break about emergencies, and so we try to do a quick in-service at staff meetings.
Okay, great. Thank you. We'll just go ahead and move on to the next question. What do you recommend for the carrying or storage of EpiPens for allergic students? We get a lot of questions about when is the child old enough to carry it, and is it okay to only have it in the nurse's office versus on the child or near the child in the classroom?
This is Ruth from Massachusetts, and once again, we take an individualized approach, and it's the comfort level of the student and the parent. We almost always have an EpiPen available specifically for that student in the health room, except at the high school level as that starts to, the responsibility really shifts to the individual with the allergy. And some parents would like to have a second one available in the classroom, and some parents want their child or the teacher that's escorting their child around the school to carry it on their person. And so we try to accommodate all those different desires. It's never locked, it's fully available, but we do take our cues from the family and their comfort level.
Yeah, and this is Mike from Connecticut, and I think this picture here is worth 1,000 words in terms of accessibility to the epinephrine and the EpiPen. So one of the things that we did was we took it out of our medication cabinet in the school nurse's office and left a little sign on the door and leave the EpiPen, our stock EpiPen, in our orange emergency bag so that if we ever had to evacuate the school, the emergency bag comes with us, but this way that the EpiPen is always accessible on the outside pocket of that and the staff know where to find it.
Right, and the reason why we wanted an unlocked place which is easily accessible is that anaphylaxis can occur really within minutes, and so that you would want it ideally an auto-injector within minutes of where a student may be, because there have been studies that show that if you give epinephrine earlier, that can actually prevent the reaction from progressing to more serious complications.
This is Nancy from Michigan. The other important thing is that when you talk about having multiple EpiPens in a school, it's important that everybody knows where those sites, those EpiPens are for these specific individual children, and that also, if it's in a different site than in the office or in the clinic, that those individuals actually know how to use it. We've had lots of concerns in Michigan about bus drivers using EpiPens. In Michigan, most of the bus drivers would not be using an EpiPen. They would actually pull over and call 911, and then the EMT people would use that. So it's good to have a lot of Epi around, but it's important to know that the people that that are going to be trained to use those EpiPens.
Okay. Do you want to move on to the next question then? Should school plans differ whether or not the school has a full-time nurse?
This is Ruth from Massachusetts, and I guess the plan would be the same, but who is the person that makes sure that everybody informed about the plan may vary depending on whether there's a school nurse there or not, because the plan is avoidance and then in the event of an exposure to respond appropriately. So we need to all still be focusing on those strategies, but with the absence of a school nurse, then there has to be somebody else who would assume the responsibility of being sure that that net is cast very far and wide so we can inform as many people in that community as possible.
Yeah, and this is Mike from Connecticut. I'd like to just add that when you're talking about plans, you have to look at the two aspects to plans. One is the emergency plan, and then the other is the general plan for the child to be safe during the school year. So if there's not a full-time nurse available in that school, there needs to be a nurse available to consult on what makes sense on a daily basis to keep those children safe in school.
And another thing that's going to need to be taken into account are those without known allergies, that in many schools throughout the United States, the only person who could administer stock epinephrine, an auto-injector that it has not been prescribed for a specific student, is the licensed school nurse. And in cases when a school nurse is unavailable, there is no one who can treat the unknown, the first-time allergic reaction. And data in Massachusetts from mandated reporting of epinephrine administrations to people in the school building who have experienced anaphylaxis show that about 25% of these people have not had known allergies at the time. And the person in almost all states throughout the United States, if they do have stock epi, who can do this is the school nurse. And so in schools where this is not an option, then again, the staff needs to be extremely quick in the way they contact 911, contact the school nurse to get there as soon as possible, or others who are licensed providers.
Okay, we're going to go ahead and go to the next question, and that is, how should the child be best prepared for managing his or her food allergies at school?
I'll start it off just in general. Children should be participating in self-management in developmentally appropriate ages, really from very early on. So the little ones know that if a parent doesn't give the okay, if a parent hasn't read a label, then they will only eat the food if, I said parent, but it really should be an adult who they can trust. They know not to put their hands in their eyes, nose, mouth without washing their hands first. They don't share. They know that their emergency medicine comes with them at all times. They know to tell an adult if they think they're having symptoms, if they may have had an accidental exposure. They know what to look for and what might be the feelings that they might have with an allergic reaction. And this is something that will benefit them in the entire community, not just in the school community. But then to work with your school nurse, with your teacher, to then continue these self-management practices in the school and specific to the school setting is going to really empower them and get them comfortable.
Okay, terrific. I'll just go ahead and move on since it's already 10 of 3 and we need to kind of keep going along. Thank you, Dr. Mike. How do we raise awareness with other school children and their parents?
Well, I could tell you that in Connecticut, in our district, when we implemented our food allergy plan, which I want to say like finally, it took years to get it where we really wanted it to be, but we're really happy with the guidelines that we have, the standards we have throughout our whole school district now, that when we did the plan, that we sent home communication a couple of times to parents, and we posted it on our website so it's available to the public to see that this is the plan. And the plan has spelled out responsibilities for school staff, responsibility for families, responsibility for the students, responsibilities for the nurse, and so on. So we sent everybody home a copy of the plan. So that, I thought that was very helpful.
This is Nancy from Michigan. In echoing what Mike had to say, when we were developing our plans in Ann Arbor in the district, we actually involved a large community of families that had food allergies and families that did not have food allergies, because this does impact everybody. So that involvement really helped with the implementation of those guidelines. And as Mike said, it's really important keeping the lines of communications open with families annually and keeping it positive.
Yeah, the positive tone you can get lost in the civil liberties of the right to bear peanut in school. So you're so you want to, but that's a lot of the misperception, and providing facts to people really helps. So our plan starts off with just a list of the basic facts that a lot of people don't realize, like the first-time allergic reactions occurring in school and so on.
And with school nurses having access, or any of the school consultants being able to then train the teachers, who then have an increased awareness, who can then train the parents of both kids with and without food allergies, and then they can talk to their children, and the teachers would also teach the children in their classroom, an increase in understanding and empathetic environment there. What happens is the kids teach their parents when they come home, the parents teach the kids, and you have an increase in awareness within the entire school community.
Okay, thank you. I'm going to go ahead to the next question. It might not, I'm going to skip over a couple in case I think we're a little bit out of order. We want to address some cafeteria and recess concerns. We have questions from parents regarding, should my child have to sit in the nurse's office to eat lunch, or does he have to sit in a table by himself? And I just wanted to know how effective strategies are for dealing with these kind of situations.
Well, I could just say that one of the approaches that we took in our plan was we stopped serving peanut, tree nut, and not that we served a lot of shellfish, but we included that into the foods that we don't serve in our cafeteria, so that we could at least have some control over the amount of peanut and nut products that are in the cafeteria. And so, yeah, we would try to set up, depending on the age of the kids, peanut safe and nut safe tables. And we knew that if you got your food from our cafeteria, for example, that you were peanut and nut safe. So we didn't have to inspect lunches. We just knew you're buying lunch from us. Then that was one approach that we took, which really made it much more inclusive for the kids with allergies, and much easier, and really helped to have them not singled out so much.
This is Nancy from Michigan. This is a very hot item in our school district about the cafeteria, and there are lots of worries and fears for families for their children in the cafeteria. So what I do is I really try to invite families to come into the cafeteria and actually eat lunch with their kids in the beginning, so that they can see how it actually works. Sometimes that scares them even more, but sometimes it doesn't. It really helps them see what the risks are in the cafeteria. Once again, it has so much to do with what's developmentally appropriate for that specific child. I also work in a middle school, and at the beginning of the school year, a lot of these families will tell us that these kids are going to eat at the allergen-free table, whatever you want to call it, and after about the second day of school, there's nobody at that table. And we're wondering, where did all these kids go to? Well, they've already decided they're going to sit with their peers and figure out how to negotiate the culture in the cafeteria. So it's a really hot item and a lot of worries for families. So I really encourage them to come to the cafeteria and see what happens.
And one thing is also,
this is Ruth from Newton, and one of the things that we do focus on in our training at the beginning of the school year are the lunch staff, because we know it's a vulnerable time for kids when they're having their lunch at school. And very often when they're having lunch, their classroom teacher may not be with them. This is in the elementary school in particular I'm referring to. So the nurses do focus on training those lunch monitors or any volunteers that might be in the classroom to understand the risks for food allergy, to enforce our no sharing, no trading food policy, and to have early recognition of the symptoms of an allergic reaction.
And while all of this is being done, we really do need to be careful not to isolate these kids with food allergies, that there can be alternatives to the child isolated, sitting by themselves, and there need to be. that when there are these circumstances where isolation is occurring, this is where a powwow with the teacher, with the school nurse, with administration, the families and their liaisons and these teams can come up with alternative approaches to sitting by yourself.
Right. And this is John. So one other point I wanted to make was, I mean, we're talking about the cafeteria and reactions there, but one point that people may not realize is actually the majority of reactions don't occur in the cafeteria. In Massachusetts, we have a mandated epinephrine reporting system where every time epinephrine is used, it has to be reported. And in that study, they actually had seen that 46% of epinephrine use was due to reactions occurring in the classroom, while only 9% occurred in the cafeteria, which may go to show that we do have effective precautions in the cafeteria. But this also makes a point that it's really the teachers who are key in preventing reactions in the classroom, whether it's food brought in from the outside or whether it's food used as part of the arts class or the curriculum, so that training teachers in food allergy awareness is also very important in preventing reactions.
And John, I'd just like to echo that in terms of what we try to accomplish with our district allergy plan, so that if we take that standardized approach, that we don't bring food that's from home into a classroom and to be shared with students across the board, then you don't have to worry about having to address that on an individual basis. It becomes more the culture and the standard of the school.
Okay, that about wraps up the questions that were from last session. But I have one question that came in that I think is really important, so I'm going to ask if any of you would like to answer it, and that is, how do you get a child to speak up if he or she is having a reaction?
This is Nancy from Michigan. My how we work with kids to actually, I have kids actually practice with their parents. So to actually do some role playing and practice. And I think that's very important for them to be able to practice, to be able to advocate for themselves.
Yeah, that can be very difficult too, because it's embarrassing when they know that they screwed up. So they know they weren't supposed to eat something and they just wanted to try it. And so then they have to sort of fess up that that's what happened. So that's one consideration. The other consideration is we have a number of special ed students who are not verbal. And so an accidental exposure there, sometimes you have to be very tuned into the subtle cues. We had one student who just walked into the nurse's office and she was just lightly scratching the side of her side, and sure enough was beginning to have an anaphylactic reaction.
Wow. Okay, sometimes the buddy system can work too. I know that from my own experience with my own son. Okay, well, what I'd like to do now is just wrap up. And Dr. Mike, do you have any closing thoughts? Because we pretty much addressed most of the questions, and it is 3 o'clock, and I'd like to move on to the giveaways, unless you have some more things
I think
you would like
just
to
the
add.
final thing is that, and I think that our team here, everybody did an amazing job of really bringing it back from each specific state, each specific school, that there are these general approaches, this prevention and emergency preparedness, that even though we're going to have different kids, even though we're going to have different schools, some are going to have kindergarten, some are going to have 12th graders, these same approaches can then be implemented based on the resources of the school and the specific children involved. And as long as those strategies are taken into place, then our kids are all going to have very safe and wonderful school years.
Okay, great. Well,
And to
thank you so
advocate
much.
for school nurses.
Absolutely. You know, I can't drive that home enough, that the full-time school nurse is absolutely key. They're the food allergy champions. Not only that, I mean, not only food allergy, but we really have many health issues that we are reliant on our school nurses. And having decent ratios of students to school nurses and having a full-time nurse available for those first-time allergic reactions, having a school nurse available for any allergic reaction is going to be so key, because this is what they're trained for. Right now, we're training our delegates, and that's really great, and it's wonderful that non-licensed people can administer epinephrine, but the truth of the matter is that the majority of administrations, again, in the Massachusetts mandated reporting study, the majority were done by school nurses, and school nurses train for this and recognizing anaphylaxis. And so anytime we have the ability to put in a request, that is something that's really important to our kids.
Well, terrific. I've gotten some requests for more tailored information about preschool, so maybe we could do that for a future session. And also a lot of questions about cafeteria issues, policies, training, things like that, so that might be a topic for a future session as well. So I want to thank everybody for being here on the panel today and for the parents who submitted their questions. I hope you got some valuable information out of it, and I'm so appreciative of the panelists who took time out of their busy days to be here with us. I know for those of us with children and going off to school that it's a nerve-wracking time, so I hope some of these answers and insights have helped allay some of your fears and give you some information to help you advocate for your children at school. So now what I'd like to do is go ahead and give away 3 copies of Dr. Mike's book, and the winners of those are Elizabeth Calfee, Jen Swagler, and Melissa Lennon. So we'll be in touch with you to make sure we can get a copy of those books off to you really soon. The winners were selected at random by our web developer, Melanie Carver, who is handling all the technical aspects of this webinar today and for whom I'm very grateful. So thank you, Melanie. So what I'd like to do now is give you some last-minute resources, and we're going to go through the unanswered questions and see if we can answer them in a follow-up blog post when we post the archived version of this webinar. Dr. Mike's and Dr. Lee's website is allergyhome.org, and there's a lot of videos on there and other resources, forms and whatnot for you to use maybe for PTO meetings or just for training of friends, family, school nurses, and others. So just take a look at them. You might be able to share them with your school, and they're all free. And then Kids with Food Allergies Foundation, we have a lot of resources for school on our website. So check that out. See if anything is of use to you. You're welcome to take it and use it to help you. So what I'd like to do is wrap up by giving you email information about the follow-up of this webinar and sending you an archived version of it, which will be available in a few days. We have to convert it to a useful format that we can upload onto YouTube to share with you, so it takes us a little bit of time. And we have all your email addresses, so we will be following up with not only that, but also giving you information about upcoming webinar topics for September and for October. So as I wrap things up here, I'd like to thank you again for coming, and when you exit this webinar today, we're going to have a survey for you to take, and we encourage you to give us your feedback to let us know how you liked the session tonight, or today rather, and if you have any suggestions for future webinar topics. So with that, I'm just going to say thank you for attending. It's 3:05, so I hope that you found this beneficial. I want to thank our panelists, Dr. Mike, for organizing the panelists for us, and with that, I'll just go ahead and close the session. Thank you again.